Atopic dermatitis, aka eczema. This is a chronic, itchy skin condition that often starts in infancy or childhood. A lot of patients have a history of asthma, rhinitis, or a family history of allergies. Eczema looks like dry, itchy patches. They can have vesicles. A key finding is the location. It is found on flexor surfaces. Make sure to educate the patient on known triggers, like allergens, heat, sweat, and harsh soaps. Patient should be consistent with skincare and hydration. How do you treat it? For most infants, it resolves on its own. For all, the starting point is prevention, with either topical steroids or a moisturizing creams. This helps maintain the skin barrier. For moderate or resistant cases, you can prescribe tacrolimus ointment. It blocks interleukin-2 to prevent T-cell activation. For severe cases, add on oral steroids short-term.